Have you ever stopped to think about this? Some medical tests, the very ones we've been told to rely on for decades, could actually pose more risks than rewards once you repass the age of 70. That might sound surprising, maybe even uncomfortable. But it's true. As we grow older, our bodies change. Our risk profiles shift. And the value of routine screenings, once essential in our 40s and 50s, starts to fade. Meanwhile, the potential harms quietly increase. Suddenly, a test that used to be protective might send you down a road of stress, follow-up procedures, or even treatments you didn't need in the first place. So today, we're clearing the air. In this video, we're breaking down 5 health checkups that older adults, especially those over 70, may want to avoid. And why saying no could actually protect your well-being more than saying yes. Welcome back to DocWise USA, where your health is guided by facts, not fear. Here, we focus on what matters most: living longer, living better, and making smart, science-based choices, especially in your later years. If you're in your 70s, 80s, or approaching that stage of life, this video is for you. And if you're caring for someone who is, the insights we're about to share could be just as vital. Let's dive in. 1. PSA test for prostate cancer. First on our list is the PSA test. This test measures levels of prostate-specific antigen in the blood and is often used to screen men for prostate cancer. Now, that might sound like a good idea. Early detection saves lives, right? Well, not always. Here's the issue. In men over 70, prostate cancer is often very slow-growing. In many cases, it remains completely harmless and never causes symptoms or complications. But when a PSA test shows a high result, it can trigger a cascade of follow-up tests like biopsies, Mr. or even surgery and radiation therapy. And those treatments? They come with real risks. Incontinence erectile dysfunction, infection, bleeding a major hit to your quality of life. And here's the kicker: studies show that these treatments don't necessarily help older men live longer. That's why major medical organizations, including the U.S. Preventive Services Task Force, recommend against routine PSA screening after age 70, unless you're higher risk or experiencing symptoms. So if your doctor suggests it, ask questions, know the risks, and understand that sometimes less testing can lead to more peace of mind. 2. Colonoscopy. Next up, the colonoscopy. This test is a gold standard for detecting colon cancer, especially between ages 45 and 75. But once you pass that 75-year mark, the equation shifts. Let's talk logistics. Preparing for a colonoscopy is hard on the body, requiring harsh laxatives, fasting, and hours of bathroom time. The sedation used during the procedure carries more risk the older you get. And the procedure itself can cause serious complications in seniors like intestinal bleeding, perforation, or heart rhythm problems. If your past colonoscopies have been normal and you're not showing symptoms, the risks of continuing routine screening may outweigh any potential benefits. But that doesn't mean you should ignore your colon health altogether. There are non-invasive alternatives like fecal immunochemical tests, stool DNA tests. These tests are safer, easier, and can still detect signs of cancer or polyps. So before you schedule another colonoscopy, just in case, talk to your doctor. You might be better off choosing a gentler approach, skipping it entirely. 3. Mammograms after 75. Ladies, this one's for you. Mammograms have long been a cornerstone of preventive care. But once you're over 75 and, especially if you have no family history, no prior issues, and good overall health, routine mammograms may not be necessary. Here's why. Many of the breast cancers found at this age grow very slowly. They might never cause symptoms, never spread, and never affect your lifespan. But once detected, they often lead to a chain of interventions like biopsies, lumpectomies, radiation, or even chemotherapy. And for many older women, these treatments may not improve survival, but they can absolutely reduce quality of life. There's also the mental toll. False positives are common, which means more tests, more waiting, more worry. And for what? If you're healthy and haven't had issues in the past, it's time to start a different kind of conversation with your doctor, not about fear, but about what really matters now. Focus on your whole health, not just your breast health, and consider letting go of this one-size-fits-all screening. 4. Cervical cancer screening. Now, let's talk about cervical cancer screening. If you're a woman over 65 and you've had several normal pap smears in the past 10 years, you may no longer need to continue these tests. Why? Because the chances of developing cervical cancer at this stage in life is it never had abnormal cells or tested positive for HPV are extremely low. Yet, continuing to screen can bring more problems than solutions. Uncomfortable exams, false positives, follow-up biopsies, and unnecessary procedures that only add stress and risk. Unless you have a history of higher-risk HPV, abnormal pap results, or a weakened immune system. Most guidelines say it's safe to stop pap smears after 65, of course. Talk it through with your provider, but know that not every test you started in your 30s needs to follow you into your 70s. Sometimes, letting go is the healthiest choice you can make. 5. Full body scans without symptoms. Finally, let's talk about full body scans. You've probably seen ads. Get a head tudo scan for early detection. They sound proactive, even life-saving. But the truth is, these scans often do more harm than good, especially when there's no medical reason to get one. They tend to uncover harmless abnormalities, what doctors call incidental findings, that lead to a domino effect of unnecessary tests, biopsies, anxiety, and sometimes dangerous procedures. On top of that, many of these scans expose you to radiation, which over time can actually increase your risk of developing cancer. Unless your doctor has a specific concern or symptom to investigate, full-body scans should be avoided, especially in older adults. When it comes to screening, more is not always better. Sometimes, more means more fear, more cost, and more damage than doing nothing at all. So, what's the big picture? When you turn 70, healthcare shouldn't just be about preventing disease, should be about preserving quality of life. That means being wise about what tests you still need and just as wise about which ones you don't. Before saying yes to any screening, ask these 3 important questions. 1. Will this test change the way I'm treated? 2. Do the benefits outweigh the risks for someone my age and condition? 3. Is this test aligned with my personal health goals and values? If the answer to any of those is no, it's okay to say, let's skip it. Because real health isn't just about doing more about doing what's right for you. If this video helped you look at your health differently or helped you protect someone you love, give it a thumbs up, share it with a friend or relative who's navigating these decisions. And be sure to subscribe to DocWise USA for more clear, compassionate, and science-based health advice made specifically for older adults and the people who care for them. Stay informed, stay empowered, and most of all, stay wise with DocWise USA.